everybody. We are doing the Eliminating Headaches, the Drug-Free Truth Revealed webinar. My name is Dr. Marco Caravaggio, and we will be recording this to hopefully have it as a rebroadcast at a later time. So I'd like to welcome everyone to the workshop and to the webinar here, and let's just get started. So let's get right to the topic. First, where are we? My office is in Markham, Ontario. I'm in the northeast part of Toronto. The office is at 3160 Steeles Avenue East in Markham. That's where I'm broadcasting from right now, and hopefully this webinar will be seen possibly around the world. So a little bit about me, the presenter tonight. So I consider myself a pediatric and family chiropractor. And some people who aren't familiar with chiropractic or fundamentals might be saying, why would a chiropractor be working on children? And hopefully by the end of the webinar, it'll be very obvious why that is necessary. So I graduated from 1994 at the Canadian Memorial Chiropractic College. And after I graduated, I went on a dream mission to kind of go to Italy. And I opened a family practice there. I was there for 15 years. And then approximately 4 years ago, I came back to Canada, and now I'm working in Markham. So after I graduated, I did a lot of extensive postgraduate studying, specifically in pregnancy and pediatric care for chiropractic. I've had interest in nutrition even before I went to chiropractic college, and I've always been up on that, and I know all the latest research with nutrition. And within chiropractic, I have a great interest in something that we call chiropractic functional neurology, which is looking at not just the spine and the nerves, but we're also looking at brain function as well and how that can be influenced. And that's one of the reasons why we work with a lot of children and children with ADHD and autism spectrum disorders and those kind of things as well in our office. So let's get to the topic. I have a lot of research here, mainly from American sites, basically American studies and things. So we just kind of relay the information to respective Canadian percentages. But about 1 in 8 adults suffer from recurring severe headaches and migraines that interfere with their daily life. About 15% of women and 7% of men suffer from migraine headaches. What are the causes of headaches? It can be a number of different things. Some of the things implicated are foods, environmental stimuli like noises, lights, stress, and behaviors that people can have. Insomnia, excessive exercise, blood sugar changes. Just going to highlight that one a little bit with the blood sugar. There's something that we call a weekend headache. And 5 days of the week, the person is fine. Saturday comes along, they sleep in, they wake up with a headache. So what happens with these people sometimes is there's a specific sensitivity that they might have that every day they're waking up, let's say at 7 o'clock, they have breakfast, and then they go to work. So, somewhere around 7:30, the body's getting some blood sugar. They're having a meal of some sort. So Saturday comes along, they're sleeping in maybe 2 hours later, and the body was kind of expecting something to be in the blood by around 7:30 or 8 o'clock, and it doesn't happen, and then there's that sensitivity. So one of the things these people can do, if they do want to sleep in, is just have a light snack right beside their bedside. So it could, maybe something like some raisins or a couple almonds, something that's, easily digestible and not a big challenge for the system, but that can just get some good micronutrients or macronutrients into the body, like some carbs and some vitamins and things like that. And a little bit of water obviously would be good too. And we'll get into why water would be important as we go along. So approximately 5% of all headaches are warning signals caused by physical problems, aneurysm, meningitis, some other problematic thing. But the majority of headaches are, the run-of-the-mill 95% of just the headache itself is the problem. So foods that may cause headaches, some of the main implicated ones are things that contain high levels of caffeine, like chocolate, cocoa, coffee, and sodas. Migraines specifically are going to be high sugar, high salt content foods, high protein foods, dairy products, and red meat. And I would also actually add red wine into that list. And most people who have migraines kind of know the main trigger foods that can cause problems. Alcoholic beverages are really important to avoid, not just because alcohol causes brain damage, but because it actually dehydrates the body. And that's another reason why coffee and teas are also a problem too. Even though you're drinking fluids, these are actually diuretics, so making your body lose more fluid than you're taking in. So we actually know a large percentage of people actually have a headache just from the fact that they're a little dehydrated. And if you're waiting until you feel thirsty before you're drinking, you've actually reached the first stage of dehydration. So that's not a good thing. So really, people should be drinking good, clean sources of water, maybe with a little lemon, I recommend people put a pinch of what we call real salt or Himalayan crystal salt, just a little bit of that. That adds a little bit of active minerals into the salt as well, into the water as well, which is really great. But a good, clean source of water, having it regularly. But I'm going to go into the nutrition aspect a little bit and just expand on that a little as well. So primary headaches, as I mentioned, account for about 95% of the headaches. So tension, migraine, cluster headaches, etc. They're not caused by disease. The headache itself is the problem. But I want you to look at this last line here. They are associated with muscle tension in the neck. So they've actually been predicting more or less about over 90% of the headaches that people get are actually caused by a mechanical problem in the joints in the neck. So muscle tension or joint problems in the neck are creating the majority of headaches. So I want people to put on their thinking caps a little bit. So I have a mechanical problem in the joints of my spine in my neck. Will taking a drug change the mechanics of my neck, joints, or the muscles in my neck? Hopefully people will think a little logically about that and say, well, yeah, it might change how you feel, but it might not change why this is happening. So that's really where our focus is tonight. So today Americans, and of course us Canadians too, are engaging in more and more sedentary activities than they used to. And more hours are spent in one fixed position, maybe assembly line or just so many more jobs just sitting all day. And this is increasing joint irritation, muscle tension in the neck, the upper back, and the scalp, and that can actually cause the head to ache. So what are the treatment options that people are going for? The majority of people will do medication. Some people are familiar with the diet and the potential triggers. More aware people will actually start to change their posture, look at their ergonomics in their workspace. Stretching is important, light exercise, and chiropractic care is one of the main things. So we're just going to look at some of the medications. I'm not going to harp on this too much, but I just want people to be aware of what they're actually doing to themselves when they're taking these pharmacological agents. So a simple one like aspirin has a lot of bad influences on our GI tract. You'll find most of them actually do, but we have like dyspepsia, heartburn, indigestion, blood loss, bleeding from the GI tract, allergic reactions, could be asthma-like symptoms, itchiness, a bunch of things like that. Motrin, ibuprofen, abdominal cramps, discomfort, constipation, diarrhea. Constipation is a big issue, and I'll get into why that could be an interesting thing, because a lot of people get what we call rebound headaches, where taking the drug helps for a little while, and then all of a sudden, because they're taking the drug, they're getting worse headaches. And when I get into this constipation issue, I'll talk about that a little later, why that can be a big thing that you really want to have cleared up if possible. So now, just for almost like a joke, if we look at one of the side effects of taking this for, if you're taking it for a headache, one of the side effects could be a headache. So Dr. Mendelsohn was a really great pediatrician a number of years ago, and he actually said, I used to give patients a drug for anxiety, and one of the side effects was more anxiety. So I said, I didn't know if I should have taken them off the medication or doubled the dose. And that's sort of like the funny twist we take on this sometimes. If we look at amitriptyline, once again, constipation again, increased sweating, sleepiness, the weight gain, confusion, a number of different things here. And the last one we're going to look at is Imitrex, which is even more devastating as far as cardiovascular stuff, really affecting the heart in a bad way. So, even though you may feel better when you take the medication, you really want to look at the long-term implications of doing this to your body. So we're going to look at the nutritional aspects that I was mentioning before. So no two people have the same identical nutritional needs. Headache patients also differ in their needs simply based on their condition, contributing factors in their lifestyle, their profession, their goals, etc. So this is coming from an article, so I'm going to add my little 2 cents in here. So there was the old advice, 8 glasses of water a day, stay hydrated. That's really important, I agree with that, but not everybody's the same. So if we just look at, for me, the hydration is really an important issue, but if you look at somebody who maybe is like a vegetarian, for example, a good hardcore vegetarian, the main portion of their diet is actually fruits and vegetables and just some seeds and nuts. If you look at that, fruits and vegetables are 70, 80, 90% water, so these are high water content foods. So if that's the majority of their diet, they might not actually need to drink any water at all. But somebody else who's eating, meats and steaks and McDonald's and, fried foods and, potatoes and whatever else, very low water content, so that person would have to drink a lot of water all day. So how can one person know, well, how much is the right amount of water they should be drinking? So I said, well, because each person is different, you can still look at clues that your body can give you. And one of the biggest ones I recommend to my patients is just to look at your urine when you go to the bathroom. And if your pee is a very, very almost clear as water or just slightly pale, then that's actually a pretty good indicator that you're pretty well hydrated. But if you notice that it's really dark orange or dark yellow, that means you're not even close to being hydrated properly. And some people might be aware of this. If you've ever gone out on a day where maybe you're working outside, you're sweating a lot, when you come back in, the first pee that you have after you've been outside is usually a much darker color because it's a very concentrated urine. So that's just something just to be aware of your body. So just keep observing that and keep increasing your water content until you see that it almost looks like water itself when it's coming out. And then you've hydrated yourself properly. So once again, the other things I already mentioned, avoiding the caffeine, the migraine triggers, etc. So there's a lot of different nutritional things that could be helpful, a lot of B vitamins, different elements here. But generally speaking, what we're going to be looking at is you'd like to have a good multivitamin, a good mineral, a lot of B vitamins, an antioxidant supplement, servings, at least 5 servings of fruits and vegetables, heavier weighted towards the vegetables preferably to reduce the sugar content, a really good omega-3, and an excellent probiotic. And once again, probiotic, I'm going to get into that because that's important for your digestive health, for having regularity, and a number of other issues as far as having good bacteria in your intestines. And that's important for your nutrients as well. So I like simplicity. And, a lot of people, when they take their vitamins in the morning, they'll open up their vitamin C pill and take that, and then they'll go over and take their A, D, and E, and then they'll have maybe like the B complex vitamins, so they're taking 4 or 5 different tablets and then other things like that. So I like to simplify things. In an ideal world, people would be taking organic fruits and vegetables and juicing them and drinking that and, having all their vitamins and minerals coming from the diet, but unfortunately that's just not too practical nowadays for most people. So I have my favorite nutritional thing that actually takes most of these and puts it all into one thing. So my personal favorite is something called Vima, and it's something I've been aware of for over 5 years now. When I was in Italy, I started taking it, and my whole family takes it. And it's an American company, and it stands for Vitamins, Essential Minerals, Mangosteen, and Aloe Vera. So it is a direct selling company that is like Amazon. You order from the company and they ship it to your door. But the reason I like this is a number of different things. It's a liquid, so it's highly absorbable, and it's just like a 2-ounce shot or something that you pour into a 2-ounce shot glass. And it's liquid, and you have it in your fridge, you open your door, there it is. But what it does is it actually replaces all of these things. So it's a multivitamin, it's a mega mineral, it has ionic plant source minerals, it's got all the B vitamins, it's a high antioxidant, it's maybe one of the highest antioxidant supplements that there is out there. So, but the other big reason I like it is that it's also present in the physician's desk reference manual. They actually did a really big, expensive study on it. They did what they call a randomized, double-blinded, placebo-controlled trial. Big, complicated thing, meaning that they gave a sample group the actual Vima. They gave a bunch of people sugar water, basically, or something that was similar. It didn't have any vitamins in it. And they compared them. They looked at their blood after a month of taking this, and they analyzed their blood. And these are some of the things that they found. So if we look on the top right, ORAC stands for oxygen radical absorption capacity. That's quote-unquote your antioxidant capacity of this vitamin. So the gray line along the bottom, those are the people that were drinking the sugar water. Nothing changed in their blood as far as their capacity to absorb free radicals, but there's a really big increase in people with the Vima. Within 1 to 2 hours of taking it, there was a good peak, and it stayed pretty consistent for like 6 hours even after they had ingested this. So the body had a high increase in antioxidant levels. If we look over here on the left, the Vima group also had a statistically significant increase in what they call their immunity markers. So meaning that their immune system is actually healthier. And this one is extremely important. There's something to measure in your blood called C-reactive protein, which is a general measure of how much inflammation is happening in your body. And more research today is showing that chronic low-grade inflammation is one of the big causes of most of the major diseases killing North Americans right now. So the better you can have a lower inflammation rate, the better it is. So what they found in the study is that the people who took the VIMA had a statistically significant decrease in their C-reactive protein, and it actually became lower than this number 1 value, which is something like a marker, like a level that is very important in the medical industry for having a proper amount of inflammation in your body. So putting all these things back together, this is a simple 2-ounce shot that you drink in the morning with your breakfast that tastes pretty good, and you get all this amazing benefits out of it. So that's why I like it. It simplifies people's lives. So on my website, you can go to drmarcodc.com or networkfamilycarecenter.com, and there's a tab on there called Nutrition, and that'll open up this page. And on this page, I also talk about the omega-3 that I specifically like. There's one that actually is a mammalian source. It doesn't come from fish or krill, and I like that one specifically, and you'll understand why. And then I also mentioned the probiotic again, which is very important for intestinal health. So let's just look at some of the strategies. What can you do? I mean, you don't need any exercise equipment. You know, your neck is the biggest thing that's going to be causing this. So let's put your neck through some good range of motion so we can see how we can improve things. So very simply, you know, you can take your position here and you're going to actually flex your head as forward as far as you can, back as far as you can, one ear to one shoulder, one ear to the other shoulder. Have a good stretch. Feel that you're stretching at the tissues, and you know don't want to be causing any pain when you do this, but just go as far as you can. So when you're bringing your head back like this, often people have rounded shoulders as they get in a sort of stressful life. This one might be a little uncomfortable, but you'll find you'll be able to go back even further with your neck if you make sure that your spine is nice and straight and you bring your shoulders back. That'll actually leave even more space for your neck to go back further, to have more stretch and more extension into your neck. So really, you'd like to do this. If you got a desk job, you should really be doing this every 30 minutes to an hour. And you know, it's important to do, and I would really recommend that you actually get up out of your chair, stand up, shake it out a little bit, and do this. You know, it might look funny to your coworkers, but you know, you want to keep as healthy as you can. So, you know, it's your health, it's your body. So exercise in general is really important. Low impact exercises would be beneficial for sure. If you want to avoid like heavy pounding exercises if you have the throbbing type of headaches, obviously. So my absolute number 1 recommendation for your best overall health and wellness as far as a piece of exercise equipment is this one thing. So I'm going to talk why this is important. So it can have profound effects on moving the lymphatic and the digestive systems to decrease what I like to call the auto-intoxication headaches. So just to talk about this system here, the lymphatic system, if people aren't familiar with that, inside your body you have your blood, which is circulating through your blood vessels, but outside of your blood, around all your tissues, there's another fluid called the lymphatic fluid. And you could consider that like the sewer system of your body. Toxins are dumped into that system, and that system needs to be eliminated. So what we like to do is the blood going through your arteries and your capillaries, there's little muscles in the vessels that can actually contract them to move the blood. But the lymphatic system, and this is important, there are no blood vessels, there's no muscles in that system, in the walls of the tube. So you actually have to physically move your muscles. That's what moves that system. So physical movement of your muscles, contracting and relaxing of your muscles, pumps that system to get your toxins out of your body. So if you're sitting at a job for hours and hours on end, you really don't move your body anymore, you're really not draining that system, you're not getting the toxins out. And the other factor of that is if you look at the digestive aspect of it, your digestive system objective is take nutrients out of your food that you've ingested and eliminate your toxins. But if you have those toxins that you should have been eliminating sitting in your lower bowels for 2 or 3 days and you haven't gone poop yet, that's all sitting there stagnating. That can all really cause a drastic effect on your system, that all those toxins that should have been coming out are actually stagnating there and coming back into your system and can actually irritate your body, your blood, your brain, and it can be causing headaches. So the number 1 absolute recommendation for overall health and wellness as far as a piece of exercise equipment is called the Cellar Sizer Rebounder. And the reason this is important This is a very specific trampoline that you're bouncing on, and the up and down motion will actually cause all the cells in your body to move, expand, and contract, and it'll have a massive, almost like a vacuum effect on that lymphatic system. So let's see if the video works.
Okay, so one of the things that's really important, as I mentioned, is it's important that your lymphatic system is actually flowing properly. Think of that as the sewer system of your body. If you're sitting at a desk job all day, or you really don't move too much, that system is just stagnant. You must give it movement for it to flow. You single pass the piece of exercise equipment that will help you get that movement is something called the cellular sizer. I'll show you the link later on. It's the healing tools page of my website, or the well page of my website. It goes to the whole description of why this is important. So basically, it's a rebounder, but it's a very specific one. But the idea is you can actually get your lymphatic system moving just by going like this. Your calf muscles are working, and this will actually help you move. And some of the vacuum to get your lymphatic system cleaned out. So just think about it. That's your sewer system, and that's stagnant. All those toxins and things that should be eliminated from the body can sit around. They can sit up in your head. They can cause a lot of irritation. You can get that low-grade chronic headache for months or years because that's just moving properly. Now, the other thing I mentioned too is that sometimes people have constipation, and if you've tried all the food and you're adding fiber and foods and stuff like that, sometimes just because you're physically not moving your body enough can be a problem. So some people do like a twisting exercise to get the bowels moving. But one thing you can do specifically on this is that when you're bouncing up and down while you're twisting, so you're almost like wringing out your system to really get it moving. So it looks something like this. So that way you're actually getting side to side twisting, movement of your intestines, but you're also getting the up and down, so it can really help get the things moving and help you move. So once again, you can look at the Move Well page on my website. I go through the whole description of why this is the best piece of exercise equipment. If you only have one thing, this is it again. Thanks.
So it's actually been said that if your lymphatic system is working optimally, it's almost impossible to get sick. So that's just something to keep in mind. So another big factor with headaches is there's a very complicated joint that's just in front of your ear. It's called the temporal mandibular joint, and that's the joint that moves when you open and close your lower jaw. And a lot of people have clenching issues, or bruxism it's called sometimes, and they might need like a bite that the dentist might give them so that they don't jam their teeth together during the night. But the big thing is that the muscles that move your jaw are attached up here into your head mainly. So if they're constantly tight, that pulling of the muscle up here could actually cause sensitivity and cause headaches and that kind of thing. So the best approach for TMJ is obviously, you maybe have a good massage therapist, somebody who even works with the muscles inside the mouth. The chiropractor is very good at working with that. Other things are biofeedback is an important one too. And just in general, you want to be consciously aware that your teeth aren't touching each other during the course of the day. There should always be a little bit of space there. So some ergonomic do's and don'ts at work. If you have a phone, try not to be shoving it between your ear and your shoulder and tilting your head to the side all day. Your headset, ideally, if you can get that. Try to take those regular mini breaks like I was mentioning. We actually said that if you sit for more than 3 hours in the same position, we could almost consider that a trauma to the spine, because the holding ligaments actually start to lose their elasticity a little bit and they don't hold the spine as well. So move yourself frequently. Things you need, make sure they're positioned well or close by so you're not overextending yourself or reaching in a funny position, and make sure that your computer monitor is just at the height of like looking straight ahead. It should just be about there. So the whole topic tonight is understanding the why behind all this. So instead of trying to treat the effects, let's look at the why. And as I mentioned, 95% of the headaches that people get are experiencing is something from the neck. Now, Anar just asked a question about, could I talk about cluster headaches? Tonight I'm just going to be mainly focusing on tension and migraines. Cluster headaches can get a little more complicated for sure, and we'd have to talk about like sort of the trigeminal nerve and some autonomic nerve system stuff, which that would be a whole other topic. But there are some things we can use to address that as well. So what coordinates every function within the body? Every function of the human body, this comes from Gray's Anatomy, is under the control of the nervous system. Its function is to coordinate all other organs and structures and to relate the individual to his environment. So that's the big key. how your body's relating to its environment is basically, if that's working properly, you should be functioning at an optimal level. So the nervous system controls and coordinates all functions of the body. Your brain, your spine, and the spinal nerves make up your body's master control system. When there is nerve interference in the spine, dis-ease or disharmony starts to occur. So this is the main controller of everything, how your body heals and how you function. So it's massively important that your brain, your spine, and your nerve system is working properly. The brain monitors every cell, muscle, gland, organ, and system in your body by sending and receiving information through the spine. So the health of the spine is key for that system to work properly. If the brain cannot send or receive messages from your muscles, organs, or glands or tissues because of spinal nerve interference, they cannot function properly. So very often the nervous system interference can occur as a result of birth trauma, stress, falls, deficiencies, outside pathogens, auto-intoxication, or immune dysfunction. These imbalances can manifest as mental, emotional disorders, discomfort, distress, or pain, or headache. So I want to talk briefly about the birth trauma. As you know, I do a lot of focus on children and pediatric care, but this is a very common issue, and we're kind of going back. So let's get to the cause of the cause. So this is a sort of like a standard picture of a birthing procedure. There's something they do in the hospital called Rifkin maneuver, which is turning the baby's head and pushing it down to make the top shoulder clear, and then pulling it up to make the bottom shoulder clear. If you look at this image here, there's a lot of puffiness going on in the cheeks from this pulling action here. There's the baby's ear, and down where that black line is, that's actually the armpit of the baby. So as you can see, there's a lot of stretch and a lot of twisting going on in that neck. So we estimate that over 90% of children have what we call a subluxation or a misaligned bone in the first or second bone in the neck right after they're born. So in the child, that might manifest itself as, they're constantly crying, colicky, could be fevers, allergies, spitting up, not sleeping well, a lot of different things, not breastfeeding properly on one side or the other. A lot of different things can come from this. But I've shown this image to patients and at my workshops, and some of them have said, well, good thing I had a cesarean section for all three of my kids. And maybe some of you have been thinking of that too. Well, let's just have a C-section so we don't have to do any of this stuff. So I like to break myths a lot when I do my workshops and get people to think a little different. And I chose this picture on purpose because this picture is a cesarean section. So really, when babies are born vaginally, they're getting, as they go out of the vaginal canal, they're starting to get populated with their mother's probiotic bacteria, which will eventually go into their mouth and into their nose and into their digestive tract to give them their good probiotic bacteria. But if they're coming through the mother's belly, there really isn't the right kind of bacteria there. You're getting more staphylococcus and streptococcus and things as opposed to the good bifidobacteria and etc. So that's already challenging the kids right off the bat. And there's a lot of other ramifications, which could be another whole hour and a half, which maybe I'll go into in another webinar in the future. So think of your spine like a circuit breaker. Just like in your house, there's a specific circuit that controls a specific room or rooms or certain appliances. In your spine, between each bone, there's there's vertebrae. In between each of the bones, there's a nerve that comes out either side, which goes and controls parts of your body. So you can think of that like a wire.
Basically, as we're kind of saying, in really simple terms, we can look at your spine as like a circuit breaker for your body. So one of these circuit breakers you've got, the nerves coming in out of there, the one that's going to go to your heart or your lungs, and that part of your body won't get the proper nerve supply that it needs to function properly, to get properly.
So if we look at what causes these subluxations in our spine, it can be traumas, including the birth trauma they just went through, but also slips and falls, bad posture, sports injuries is another one there, emotional tension, stress, family dynamics, bills, that kind of thing, and toxins, chemicals, drugs, things in the environment that haven't existed before in the rest of past of human history. Sugar is a big one, secondhand smoke, NutraSweet. Artificial sweeteners are a really bad one. Most of them are what we call neuroexcitotoxins, and you really want to try to avoid those if at all possible. So we know that the body is a self-healing, self-regulating organism, and the nervous system functioning as the master control system of the body. If the nervous system works properly, great. If it's compromised in any way, the body cannot function normally. So here's a chart that we have in our office. different nerves coming out of your spine control different things in your body. They may cause different things, like for example, subluxations up in the upper neck. Obviously, being born can cause that. So that can cause headaches in people's body. But then it can also be how it affects the internal organs can also cause a number of different things too, like low energy, memory trouble, brain fog, ADHD, things in children, that kind of stuff can come from that. But if we just look down lower, the low back, for example, the nerves that come out of here in the female would control the reproductive organs, but it also has a big influence on your bowels. So if you are eating prunes and you're exercising and you got a lot of fiber, but you still have constipation, it just might be because the nerves in the lower back have been compromised and they're not controlling the bowels properly. And it doesn't matter what you do in your diet and your lifestyle, if you don't correct the nerve interference, that always might stick around. And as I've already mentioned, you know the potential ramifications of having constipation as it relates to headaches as well. So in order to have maximum health and function, you need to have the following. So this is the global big picture. Plenty of sleep, consistent exercise, a positive mental attitude, excellent nutrition, and chiropractic care. So those are the big key factors in having optimal health and decreasing your headache. Seth Sharpless at the University of Colorado did a little study, and he found that the weight of a dime on a spinal nerve actually alters brain impulses by 60%. So it's just about like 10 millimeters of mercury, just almost the sense of perception of something on the back of your skin, basically. If you just drop a dime on there, it's really not that heavy. So can you imagine living your life with only 40% function? But unfortunately, the majority of the population is actually going through life that way, and because it's common, people are thinking it's normal, and it's really not normal. It's just prevalent. It's just happening a lot. A lot of people are just dysfunctioning, and they're living life thinking that all these aches and pains and problems are just the way it's supposed to be, when really it shouldn't be that way. So subluxation and posture changes, these are the assessments that we do in our office. So let's look at the ideal posture of somebody from the side. So ideally, if somebody has all the proper curves in their spine and there aren't any distortions, the hole in the ear would be over top of the shoulder, which would be over top of the hip, through the knee, and just in front of the ankle down at the bottom. Now, something is happening more and more in society today. We know about 90% of the population has a posture profile of the head being in front of the shoulders. This doesn't make it normal, it's just very prevalent. So other than just not looking good, there's some really bad ramifications of the fact that the head is moving forward. So let's look at that. There's a big lever that's created here, and gravity starts to pull the head down. So with gravity pulling the head in this direction, all the muscles in the back here that are attached to your skull going back into your neck have to pull harder and harder to prevent your head from falling forward and gravity taking its effect. So it's been said that for every inch the head moves forward, that's adding about 15 to 30 pounds of extra tension on the muscles in the neck. So I'm going to try to use the little drawing thing here, and hopefully this will work. So the hole in the ear would be more or less here, and that's your plumb line going way down in front of it. So what happens is this lever, this angle here, that part of your spine in the lower neck, that is actually the part that in most of the people, as we go through time, we'll see that will start to develop arthritic changes. There's fifth and sixth cervical vertebrae. And that's really important. So what's happening is the muscles that are attached at the back of the skull going back here, these are very, very tight, and they're tight all the time, and they're constantly pulling, and it's really starting to stress that area. But one of the other things, just in the last 5 or 10 years, I don't remember how long ago, there's some really small muscles that are attached to the first and second bone in your neck here that are attached to your skull. They actually found a ligament that they never knew existed before, and that ligament actually goes from those muscles and it travels right inside the spine, between the bones, and it actually attaches to the spinal cord. So the spinal cord is how your brain gets into your body, and there's a sheath around it, a protective sheath called the dura mater, and that ligament goes from those muscles right into attached to that dura mater. So if there's any sort of distortion in the upper two vertebrae or excess tension in those muscles, that can actually cause a pulling tension on the dura around the spinal cord, and that's very, very damaging. And it's a very important thing. So that's really making this upper neck area extremely important for people's health in general, and just for just general dynamics as far as headaches and a number of other things. And the technique that I use in chiropractic specifically deals with the dura around the spinal cord and where the spinal cord is attached to the bones in the spine, and I'll get into that a little later. So here's a typical adult patient that's come to the office, about 8 degrees of forward head posture. So, here's the middle of the shoulder, and the head's, that hole in the ear is forward about 8 degrees. So that's maybe about an inch or two in front, so an extra maybe 15, 30 pounds of force onto the neck here. So now remember the cause of the first subluxation that I mentioned previously? That's the birth process, correct? So I want all parents to pay very close attention to what I'm going to show you here. So this is a 12-year-old girl that presented to our office. She's had daily headaches pretty much since she was 5 years old. Now, if we look at that, there's a lot of bad postural changes. The head's 11 degrees forward of the ideal here. The shoulders are actually slumping forward. So if I was actually going to take that, it would probably even be maybe 10, 15 degrees probably, because that dot, if her shoulders were in the right place, would be back here. So there's even more distortion. But a lot of stress on the upper back, on the neck. That tension can go right into the lower back as well. Now, just imagine the quality of life issues we have here. There's so many kids that now, parents just don't know this stuff. They don't know what to do, and the kids are complaining of headaches or menstrual cramps. Even young girls are complaining of these kind of things, and they have no idea that a lot of that could be related to disturbances in their nerve system caused by subluxations in their spine.
So one of the technologies we actually use in our office to actually measure the function of those nerve systems is something called the subluxation station, and it has different components to it. One of them is called the surface electromyogram. So as we know, as we've been talking, very often most of our headaches are actually produced in neck, neck discomfort, and neck problems. And when muscles in the neck are tight, they're actually producing a tension, and that tension measures surface electrodes. So if you look at this screen over here, this is the right side of the electrode, which is the red one. And so this red line, the red line here is indicating the amount of tension that's being measured. So if I just place this on my forearm like this, try to keep it relaxed. Hopefully you can see my forearm in the lines. Try to trust my forearm. You should watch the red line go up. When it relaxes, it comes back down again. Once again. So this is a way that we can measure how tight those muscles are in your spine. Remember, all your muscles are controlled by your nerves, and if there's some subluxation in your spine, your nerves are controlled, the muscles are going to be off. You'll have tension back. That can be the headaches and other problems. That can actually measure how much tension you have and have a way of measuring your progress as well. So this is one of the things we use in our office to help you with your headaches.
So keep in mind, not all chiropractors have this technology. And it's not necessarily important. Some of the techniques don't need it or whatever, but it's just something that we can use to have an objective measure, because chiropractors with their hands can feel tension in your muscles and in your spine, etc. But this is actually a way to have a physical measure and see where the imbalances are, how much tension there is, and objectively measure it and see progress. So this would be like a typical scan of an adult, for example. Within the computer, there's a standardized ideal patient with the right amount of tension. So when there's the length of the line is a measure of how tight the muscles are. So there's like a normative data we have, and when people have a normal amount of tension, it would be white. The line would be white. So green is the first level off balance, and then blue, and then red, and then black if it's extremely tight. So this is sort of a typical pattern of somebody coming in, out of the blue, off the street sort of thing. So I want you to look at this scan here. So I want you to look at how little white lines there are, almost just very little. Most of them are 2 or 3 or even 4 standard deviations outside of normal. Lots of tension everywhere. There's a big red, lots of tension on the upper right and a lot of tension on the lower left. Now I want the parents to pay attention to this again. This scan is the scan of that girl that I showed you a couple of slides ago. Now, when muscles are tight like this, it actually takes energy to contract muscles. So even though she's only 11, 12 years old, that excess tension is constantly, the muscles are constantly contracting all day, 24 hours a day, 7 days a week. So it's taking energy away from her body, and of course she's going to have difficulty concentrating, and she might be lethargic, and As she goes on, this might become a 20 or 25-year-old who has to have 6 coffees to get through the day, or that kind of thing. But the other big thing is she also has a pretty bad scoliosis in her spine. And if you can see that here, all this extra tension on this side and a lot of tension on that side, this is pulling her lower spine to the left and that's pulling her upper spine to the right. There's a lot of tension right through the middle of the lower neck and the upper back here too. So parents, I really want you to pay attention to how much of a big impact this is. So imagine if we were taking care of her from right after she was born, it's very, very possible that none of this would have ever happened and she would have grown up with a healthy spine and nervous system, and these headaches would have never even came out in the first place. So the prevention aspect of what we do is a million times more important than trying to fix this, because this is a big challenge for us right now to really work on this. And there's going to be a number of months and a couple of years of work to actually get a big impact and change on that. So I actually came up with some exercises. There's help for people who have that forward head syndrome. I actually came up with a product that I'm selling online. There's a website out here. This is the website, so markomwp.wix.com, head over shoulders. So I've actually come up with what I call my Super 8 head back over shoulders exercises. So to kind of combat this sort of forward head posture like that, there's an 8-page PDF document that I've come up with, and there's 8 specific exercises that are designed to work the very deep muscles between your shoulder blades and in your neck to help the head come back the way it's supposed to. So that's available for $4.99 for an immediate download. And I've also filmed a video course as well if people want to see the videos of each exercise being done in the description, so we can get that for $10. So at the end of this webinar, I'm actually going to leave a page on that will have all of the websites that I've mentioned. I'll leave it on for like about 5 minutes at the end so you can write down and go find these web pages and stuff. So this is something, it's a very simple thing, low cost, but you can do it at home. So even if you're not near me or wherever you are in the world, you can do these exercises. So I've gathered about 8 different exercises which I've seen different people talking about this forward head, and I put them together in what I think is the best package for people to do this easily. You don't need any equipment, it's just you and a wall. So I'm actually going to show you one here. This is one of the exercises.
Place feet 1 to 6 inches from the wall. Head, back, and buttocks must maintain contact with the wall. Bring arms out in front of body and touch elbows together, forming a V, with the wrists flexed to maximum. Bring arms to the side so elbows, wrists, and knuckles touch the wall. This is the W position. Repeat 15 times.
When you do this exercise here, you really feel the deep muscles between the shoulder blades really working. And if you have your head touching the weight, it's all described here. You're really working all the deep muscles in your back and it really helps pull your head back. So what are the experts saying? We're going to go through some of the research studies because some people are really, analytical and they want to know what's out there. So in this research study, it showed that spinal manipulation, we don't like that word in chiropractic. We prefer spinal adjustment. The word I use is called a network entrainment for the specific thing that we do. But the idea is the primary form of care provided by chiropractors can be an effective form of treatment for people with tension headaches or headaches that originate in the neck. And as I told you, we know that the majority of headaches actually originate in the neck. So the chiropractic care resulted in almost immediate improvement for those headaches that originated in the neck, and the people had significantly fewer side effects and longer lasting relief when they compared it to medication, obviously. So the big thing is that 4 weeks after the people stopped getting the chiropractic care in the study, there was a sustained benefit. But the people who were taking the medications, that didn't happen, which is obvious. If you're just treating the effects and not changing the reason why it's happening, it's going to come back again when the effects of the drugs wear off. And so I'm going to show you just my form of chiropractic, and there isn't necessarily a better technique. There's a lot of different techniques, but why ours is sort of unique is that it's a very light technique, so there's no fast cracking movements that people usually associate with chiropractic, but it can have very dramatic effects on the body. So the technique is called network spinal analysis. It's been around for 25 years or so. And the idea is that a very specific light touch on the spine where the spinal cord attaches to the vertebrae, which is basically at the very top of the spine and down at the bottom. Those light contacts in the right place at the right time can have a dramatic effect in helping your body become self-aware. Your brain finds its own tension within the spine, and your body will develop strategies to self-correct it. So what your body will either breathe or move into those areas where there's accumulated tension. And over time, it becomes like an automatic response. So I'm going to show you a video of a girl who is coming to my office in Italy. She has been coming for 5 years getting this care regularly, so she was like on a wellness basis. So she actually has what we call the 2 waves of network developed in her spine, the respiration or the breathing wave, and something called the somatopsychic wave, which you actually physically see her moving and kind of muscles twitching and working in her spine. And all these responses are actually automatic. She's not doing any of them on purpose, but she could stop. If I told her to quit moving, she could quit moving if she wanted to, but she's just kind of going with the flow, and this is the response that her body has. And just so you know, not everybody responds like this, but she's a good sort of physical movement person sort of thing that makes it obvious for other people watching.
So I'm just going to do a quick adjustment to this area. First, I'm just going to quickly analyze her spine. I think it looks good. Just to see the general mobility. Okay, so my first adjustment is going to be for this area here. So I'm just going to want to see how her body reacts. Okay, so you can see her nervous system is actually very well trained, and it's developing these strategies. These are important strategies that every human being needs, from a baby that's just born to someone who's got 130 years if we're living that long. But this is so important to have a flexible spine and nervous system. And if this is a strategy, we call this vertebrae in our neck right here, but I'm going to approach it through this area here. This is more of a second level contact where I'm trying to get her to pay attention right there. Remember, as I said in this level 2 video, we'll see figure 8 kind of movements. We know that that's a really good, healthy kind of thing because it's taking the joint through all of its range of motion, and that's sending lots of that good proprioception stimulus, as I said, to the brain. And as you can see, there's a lot of action right in this area here, and the weight is starting to go through the spine. So I can modulate a little bit how I want it. I want it to kind of go side to side and do that kind of thing as well.
So that's just an example of the care. It looks strange for people who have never seen it before. It's usually very quite relaxing when people do get the care. And there's a large percentage of the population that knows they should be getting some sort of spinal care, but they're sort of scared or they're not sure who to trust or that kind of thing. So this has a tendency to attract people that know they should be getting chiropractic, but they don't want to get quote unquote cracked, so to speak. So here's another literature review. 2,500 sources were looked at, and they looked at the different approaches like chiropractic, acupuncture, drug therapy, exercise, and relaxation techniques. What they found is that the chiropractic appeared to result in immediate improvement in headache severity. In cervicogenic, that means coming from the neck, so that's the large majority of headaches, as we've mentioned. So when compared to soft tissue therapies such as massage, chiropractic resulted in sustained improvement in headache frequency and severity. When the researchers compared how patients under chiropractic care responded with patients taking the usual drugs, like amitriptyline, for example, both had about the same immediate effect, but here's the big thing. Amitriptyline people, there's 82% of them had a bad adverse reaction. No surprise, I showed you all that stuff at the beginning. So during the 4-week period after the study ended, the patients who got the chiropractic care experienced improvement, and a significant improvement in the frequency and severity. The ones taking the drugs returned to the same frequency and severity that they had prior to the study. So once again, if you're changing the reason why it's happening, the likelihood that it's going to happen is going to decrease. So chiropractic care removes the nerve interference at the level of the spine so that the brain can send the proper messages 100% of the signals communicating with the body. Drugs, on the other hand, actually decrease the number of signals and make the brain feel less of your body, so you feel less, period. So think of the spine sort of like a little circuit breaker, so to speak. There's an Australian study they did looking at migraines, for example. So over the 6-month period, 83 people with clinically diagnosed migraines, they kept headache diaries 2 months before they started the chiropractic, during the chiropractic for 2 months, and 2 months after. 40 people were placed in a control group that received no chiropractic care, so that was the way they could control if the chiropractic was making an effect. And of course what they found is decreased frequency, less duration, less disability, and less medicine use. Half of the participants getting the chiropractic care reported improvement in morbidity level of migraines. 22% reported more than 90% reduction in the migraines. So 12% of the population suffers from migraine headaches. These are obviously American stats. So you just go back to that one again. 15 million could report significant improvement. So just think about sort of like the global impact around the world, basically, of how many people could have a change in their life because they're getting chiropractic care finally. So I just want to highlight a person, a young girl that came to my office, and this is her story.
So what were you like before you started care here? Originally I came because I suffered from severe migraines. They were so bad sometimes they would last up to maybe 36 hours non-stop, and no medicine would help no matter how strong. Also, I was having lots of back pain, and overall I was just feeling very lethargic and had very low energy. And I was recommended by my mom and her friend. They were both coming here, and they recommended I should try this. And since this is a very holistic approach, very non-invasive, I was very interested in trying it out.
And so what did you think of the initial exam?
I have a degree in psychology, so I actually could relate that a lot to what he was saying, and it made a lot of sense to me. I always knew that the brain and the body is connected to the spinal cord, but having the exam, I became much more aware of how it's important for the flow of information to be better from the brain to the body. And I realized that your spine doesn't need to be severely damaged in order for the information to not flow correctly. And I was very impressed with the test that was done through the computer. I've never seen anything like that. And the results that came out were exact to the area that I was having problems with in my back. And I was very impressed with all the tests and different tasks that were done.
So what do you think about network care?
I really like coming to the office and receiving the network care. It's very relaxing. It allows me to forget about my day's problem and just relax. As soon as I lay down on the table, there's some sort of energy in the room that right away makes me feel better and relaxed. I feel like my whole body relaxes and I'm able to concentrate on my breathing and just breathe. In a way, I feel like I'm breathing the stress and the pain and the discomfort away with each breath I take.
What has changed with your health now?
I haven't had even one migraine since, not even one. I haven't had to take any medicine for pain at all. It's only been 4 months, but I feel drastically better. My back pain is mostly gone. My posture improved. I've been told by friends and family that I'm standing much straighter. I don't feel as lethargic. I have much more energy. Before I would always feel tired and feel like I need to take a nap in the afternoon. I haven't had even one nap since. I just overall feel much better and much more energy, and energy that I have is equally distributed through the day. I don't feel like I burn out earlier in the day. I feel that I'm able to accomplish whatever I want for the day without feeling tired.
What else do you like about our office here?
I like that it's a personal approach, that I have in the relationship, that he always asks how I'm feeling. I like that it's on a regular basis, and I feel like I'm a part of the family because I see Dr. Mark and Melanie at least twice a week, and it becomes part of your life, part of your routine. When he was on vacation, even though it was only a week, I actually felt like something is missing, and I definitely love coming here, and I leave with, I guess, a bounce in my step, and I feel much better.
Thank you very much, Olga.
Results not typical. Your results may vary. Of course, I just have to say that as a joke, but you know, it is very common. Obviously, I've seen, you know, hundreds of people through my career, decades, and you know, the very common thing is that the headaches are usually less frequent. They happen less intense when they happen, and they're kind of spread out. And some people have actually had it really totally disappear. So that's pretty common when people are getting the proper care, that there should be less frequency, less intensity. And obviously, you know, different life events might have an influence on it. Obviously, sometimes when the weather changes, some people think it's just an old wives' tale, but I've surprisingly had a number of people, always on a certain Monday or certain day of the week when the weather's changing, they're all complaining of headaches. So, you know, it can happen. So, if we just look at the global picture here, there really is no other treatment choice that can offer the results of chiropractic, because we're the only ones that are actually looking to correct subluxations in the spine and the neck, and that's our job. So when a chiropractor removes interference to the nervous system by adjusting the spine, communication to and from the brain is restored, and the body is better able to function properly and heal itself. It's really that simple. So I always tell people, it's not how you feel, it's how you function. Only 10% of the nerves in your body give you feeling sensations. The other 90% you don't really know how it's working, so that's why we use our functional neurology tests and the other scans to see how that other part of your body is functioning. So life, health, happiness, and acquiring knowledge are all processes. We offer many different classes in our office so that you and your family can gain the knowledge necessary to be a happy, healthy, drug-free family. And we'd like you to join us. So what's your next step? Well, it's actually a first step. If you or someone you care about is needlessly suffering, please be sure to ask us for help. Chiropractic can help. We've been doing it for over 100 years in our profession. And, you know, we've had great results for all that time with millions of people around the world. So there's a special offer for the webinar participants. If you're currently not a client in our office and would like to come in, obviously if you live locally to us, just send an email to info@networkfamilycarecenter.com, and please note that center is spelled ER, the American way, with the subject headache offer. So you'll get the initial consultation. It'll last about an hour. So we'll have a consultation, we'll do the history, but we'll also do the digital posture analysis. We use something called rolling spinal thermography, surface electromyography, and there's something called heart rate variability, which is another test we do. And then we also have this special functional neurology test that I do, which really get the global picture of how your brain, your body, and everything is functioning. The normal value for that is $135, and you will get that for the cost of a progress exam, which we do periodically for $85. So you get a little extra bonus there. So I'd like to thank everybody for attending the webinar, and for those who are watching the replay. If you know somebody who has headaches, or anybody else for that matter, I hope a lot of the information was helpful for just people in general, just to get a better aspect on thinking about how they can think about their health. So once again, as I mentioned, I was going to leave up the links to the different things. I'm going to leave this on for a few minutes at the end. So the office website, Network Family Care Center, this is our email address. If you're the liquid nutritional that I mentioned, this is our affiliate link for that product, which I highly recommend. This is where you get the healing tools page. Is something I didn't really mention, but there's some other beneficial things, the omega-3, there's grounding tools and other things that I think are important for people's health on this page here. This is what I highly recommend for people to do your at-home work. So this is the website link to get the head over the shoulder